One of the beautiful things about the Data Plus program is that you have this combination of students growing in their learning along with us growing in our community partnerships and the sophistication of the data analysis growing from year to year. Two interesting projects. First is one that we've been curious about for a long time, which is, does the experience of being in the detention facility exacerbate mental illness? And so we just spent about an hour yesterday outlining how we would clean up the data to ask that question. How do we look at the timeline? Because we have a full timeline from 2014 to 2020. How do we break it down and ask which came first? The second big piece that the students are excited about this summer is the cost analysis. And so they're beginning to dive into, we have cost data from Duke Health. How much does each visit to Duke Health, whether it's emergency department, primary care, specialty care, how much does it cost, and is that paid for by insurance? So how would that change? So we're really excited to look at what are our sickest people costing the health system, and then how many of them are covered by Medicaid? What will North Carolina's new expansion of Medicaid mean for that? And also, wouldn't it be cheaper to treat them in a safe, secure housing facility with peer supporters and counselors on staff so that, you know, minor decompensations of their mental health can get nipped in the bud and taken care of in a safe space rather than waiting for a crisis moment to come to the emergency department. So those are the two new directions this summer.
I mean, Duke Health especially is such a massive organization, so for us to get access to that data and have the ability to link it to the jail data, I think is particularly cool. Yeah.
And so, yeah, our low-hanging fruit hypothesis years ago was, if people would just go to their doctor's appointment, everything would be fine. Of course, it was never going to be that simple. We just had to start somewhere. What we've seen in our preliminary analyses is that this group of people who are incarceration or detention facility associated tend to also cycle repeatedly through the emergency department. So their Duke Health records are overwhelmingly from the emergency department, some primary care, some specialty clinics, a lot of visits, plenty of visits to the mental health facilities, but really, really going to the emergency room more than most of us do.
We started off thinking about, I guess, what indicators might be factors into playing between the cycle of going into like Duke Health and seeing like rearrest rates. So there's like a little bit of a revolving door between like Duke Health, especially emergency department interactions, and then people being booked into the Durham County Detention Facility. So we want to look at what indicators might be the reason why we're seeing that revolving door. And now with this new program, thinking about, I guess, like policy development that could help with like recovery programs to support long-term recovery, specifically from substance abuse disorders after being in jail.
So the data quality and access to data that we have is really kind of remarkable. To have two big data sets from the health system at Duke Health and then the jail data and those linked, I think has been a long-running process, and we've gotten sort of additional data over the years. This year we added cost data, so we know about the costs to Duke Health of the health encounters. So yeah, it's been a long-running partnership.
One of the things that's recently happened that I wasn't directly involved in, but I was able to participate in conversations about, is the HEART team that started in Durham. So this is a group of unarmed, licensed, trained counselors who are first responders now. So Durham, if you call 911 with a mental health crisis that's non-dangerous, non-violent, you could get the HEART team coming to your door. The City Council just approved expanding that to citywide and 24/7. So many good things are happening in Durham in parallel, and that just makes our work that much more exciting and that much more reinforced by what's going on around us.